Did you know that PCOS affects up to 10% of the women of the reproductive age, making it one of the most common hormonal disorders? Hello and welcome everybody to today's Instagram Live with the first parents. And today we are going to discuss PCOS, PCOD, and pregnancy, exploring how diet, nutrition, and exercise can play a vital role in managing the condition during pregnancy. And for that, we have an expert joining us. So today, let me welcome Roshni Chandrasekhar, a Stanford University graduate in nutritional science with years of experience as a health coach and a nutritionist. Her expertise spans to gut health, PCOS, chronic illness, where she witnessed transformative power of a healthy gut on our well-being. And so we all have started hearing about gut flora and gut microbes these days. Yes, it's the most important factor as well. Roshni is dedicated to empowering individuals through education, personalized nutrition plans, and unwavering support, believing that even minor dietary and lifestyle changes can pave the way to significant improvement in overall health. So let me welcome Roshni. Just give me a moment while I invite her. I think some Instagram glitch. I'm just trying to invite Roshni here. Roshni, I'm trying to accept your request, but I think it's not working. Just give me a moment to, fix this. It shows you're unable to join. Uh, Can we cut it here and restart this session? I was just trying to help you join. I think there's a glitch. So, sorry, users.
I think
Okay.
I'm able to join now. So that's really nice. Awesome. Hi, how are you?
Hi, how are you? Technology, even if we've come so far, you can't do anything
And
with
I was
that.
just thinking, I was just telling, I was like, if there is a glitch, just get used to it because all my lives have some kind of glitch to start with. So I'm pretty used to it.
It's okay, it's okay. While you were joining, I was telling the users about, some statistics about PCOD and PCOS, and I, went ahead and gave your introduction to everybody so
Thank
that,
you so much.
we can directly go and ask the questions and not make it a very long session. So, I have one question before we get to the reproductive age, okay, Roshni.
Mhm.
I think PCOS and PCOD has become a very common phenomenon for all the females, all the girls. Like the moment they touch puberty,
Yes.
most of them are showing symptoms of PCOD and PCOS. They started living with it as if it is normal
Mm-hmm.
because nowadays we say, "आजकल तो होता ही है, it's common, right?" But
Yeah.
it should not be common because at that age maybe you're able to ignore and let it go by the wink of the eye, but later when you grow up and you come to an age where you want to start the family is the place
Yeah.
where people just bonkers, or people start worrying or stressed out. But it has been, you've come a very long way, and the turn should have been made long back. So
Yeah, I think
reversing this will take a longer time.
in my mom's generation, PCOS, PCOD was not never a thing. They never. I mean, the first time my mom got to know that I have PCOS, she's like, "Why do you have it?" She started blaming me because of my eating habits and stuff.
Yes.
Because that's what doctors do, right? Like I've gone through a lot of negative feedback from doctors. So at our generation, that's when like 28-year-olds and 30-year-olds, our parents think that it's our fault. And now that it's something that's so common, and now I've seen a lot of mothers get into this. I've seen like 40-year-olds, they're like, no, I have a child and she has PCOS. What do I do? So it's a very nice transformative state to going from blaming the child to like supporting the child, right? So I'm really happy to see that as well.
Yeah. So, I want to ask you, before starting the entire conversation about, pregnancy, I want to just go back, okay, for
Mm-hmm.
mothers whose daughters are going to hit puberty, right, or have hit puberty, and maybe they're showing symptoms of PCOS and PCOD. Sometimes they are silent also. You don't show
Yeah,
symptoms, right? When you
yeah.
come to very late in life, when you do a sonography or an ultrasound or something.
Mm-hmm.
But somewhat there are few things like irregular periods, heavy clotting.
Mm-hmm.
There's some sign your body shows, right?
Yeah.
So is that anything that you can simple thing, as a teenage girl who should not want to do a lot, right?
Mm-hmm.
She's already very active, her metabolism is really high. People are like, uh, doing activities at their age, like unlike, us, right?
Mm-hmm. Yeah.
So
Yeah.
what a few, maybe one or two diet thing or, a nutrition or a lifestyle thing that they can, inculcate into them so that, in the long run, they can help sustain or reverse this PCODs and PCOS system.
So a very close friend of mine, she has a daughter who's 13 years old. So
Okay.
she got her period like last year, and this is something that I converse with her almost every day. It's the right nutrition, of course. So when she gets her period, the kind of food she eats, that's from starting from dates to adding nuts and specifically dry fruits is something that I ask people to add. It's very, very important. As children, we don't really prefer it. We feel that dry fruits is something old people eat, but for a woman to have dates, figs, that's just something that they can start with. Preferably to reduce junk is something that I've always said. All the 13, 14-year-olds have birthday parties in extremely
Exactly.
high junk place, and nowadays schools start giving food as well, and even those foods
Packed.
are really, really unhealthy. So that's from pizza to burger is something that people, I mean, children at 13 have at least 3, 4 times a week, whereas we as children used to have it at least like maybe once or twice a month, right? So there's a huge drastic change. So that will be my dietary specification. But the most important that I have seen is sleep. 13, 14-year-olds have gadgets these days, and a strict rule would be to just go to sleep. So food and sleep are the two things. Physical activity wise, I wouldn't really worry because school tires
Yeah.
everyone out. So as much as school tires you out, I don't think physical activity needs to be your added concern. But yeah, sleep and nutrition is something. That's when it started for me. So I would really prevent it that way.
So going back to a personal story, obviously I was also a person who was affected with PCOD and
Mm-hmm.
PCOS. You know what, Roshni, I had irregular periods and very painful periods. But I had periods every month.
Mm-hmm.
Maybe my cycle was not 28 days, 35 days, okay. And
Mm-hmm.
heavy bleeding and very painful periods. Belonging to a small town, tier 3 city, I went to a lot of tier 1 cities like Bangalore, Delhi, Bombay to, check myself up and, get something diagnosed. But, then this word was not there, right? I'm talking
Yeah.
20 years, 25 years back when this word was not there. So the doctors couldn't really make out, like, I have a PCOD, and nobody ever told me I have a PCOD and
Mm-hmm.
PCOS. So, I thought, I lived with it. I thought, this is how my
I get it.
menstruation cycles are. And
Yeah.
one thing I specifically remember, a very close friend of mine was studying nutrition, and then she told me, Kushbu, you know what? Do two things, like add figs, soaked figs,
Mm-hmm.
and second, 10 black raisins in the morning.
Yeah.
I don't know how long it's been I've been doing this. Maybe it doesn't show the result immediately, but slowly and steadily it starts working towards that, right? So
Absolutely.
yes, I understand like that age you can't do a lot because you are rebellious, your daughters may not listen. But something which is
Yeah.
simple as this and it's in your hands, like early morning, you can just put them into their mouth or
Yeah.
force them to eat it. Something you don't have to do the entire day. At least
Mm-hmm.
something which is going into and may help with things, right?
I think, I mean, sharing knowledge as to why you're asking them to do it. would
Works
be
better.
something that, yeah, because if my mom forced me to have 10 raisins as a child, I would resent it at 20
Yes.
years. I'll be like, my mom made me hate it, so I
Yeah.
wouldn't. So I feel knowledge. My friend's daughter, I'm very close to her, so I tell her, you know what, you really need to have this food, Saika. You need to eat this because it's healthy for you. So yeah, I feel really happy to see that mothers are changing as well. But yeah.
Because you very correctly said, Roshni, our generation do not want to do anything without logic. The moment
Yes.
we understand the logic, we understand the scientific aspect of it. We
Mm-hmm.
can't just follow the rule of book like ये करना है. क्यों करना है समझा दो तो सब कर लेते हैं.
Exactly. Yeah. The reason
So
is
okay,
very needed. Yes.
yeah, totally. So I will jump off a little ahead and ask you, excuse me,
Yeah.
and ask you, what are the dietary changes and modifications for people planning to conceive with PCOD and PCOS? Now we've spoken about, teenagers, but let's
Yeah.
come to a case where, uh, when people just are so stressed, oh my God, I have PCOD and PCOS, and,
Mm-hmm.
they're planning a family, they've got a prenatal or preconception checkup done, and that's when they get worrying about their period cycle, right?
Mm-hmm. Mm-hmm.
So, now you need to start being more careful, and I think not
Yeah.
only one thing, a full day lifestyle change would require, what I understand.
Yeah.
So what are some specific foods which are foods and nutritionist food that you should focus on, and what are some things you should avoid, like totally no.
Okay. So let me just be very clear in this. You can conceive with PCOS. I've seen
Thank
a lot of people, the
you for
first
answering
worries
that. I've been
can.
tired answering that.
Yeah, so this is something, it's absolutely possible. There are a lot of doctors who worry you saying you have PCOS, you need to go into IVF and IUI. Please do not listen to that. You really don't need those treatments because that's in a way business for them. But for you, it's detrimental after you conceive. And the chances of you conceiving are 1 in 3, way to do it. Right? So yes, you can get pregnant, but you need to plan ahead, right? So all the sisters that I've been helping, they usually come to me when they are planning to have a baby, like say 6 months ahead of time, or they just want to conceive immediately. You need to plan at least 6 months prior to trying to. So if you want to get pregnant next June, you need to start planning now. Why? The focus is to first start ovulating, right? So ovulation is the most important thing for you to even try to conceive. So when you're trying to conceive naturally, you need to buy ovulation kit and you need to start noticing when you're ovulating. If you're someone with irregular periods, then the first thing would be to target that. To get regular periods, that's the main concern. Most common thing that I have seen is weight gain is around the pelvic region, which is the reason many people don't menstruate regularly. That needs to be reduced with the right nutrition. Nutrition varies for each one. My nutrition would be completely different from yours, right? So working on a nutrition plan is very important for me. So whenever I curate something for anyone, it is so it's so the nitty gritties are seen in this, right? I go from what you've eaten as a child to what you're eating now. Say you've moved countries, what's available there, what's okay for your gut. So I go into that kind of nitty gritty and say, okay, this is the meal plan that will work for you.
Okay.
Please try this meal plan. Then you start ovulating. So that's the first thing. So start working on your ovulation. It will really help you. The next thing is avoiding junk. That is something that is a complete zero. I've seen that a lot of people who completely avoid junk, which is very, very hard when you have PCOS, because mood swings make you want to eat all sorts of junk, from pizzas to ice cream specifically, because you have sugar cravings and it ruins your
Chocolate.
glucose levels and all of that, right? So junk completely avoid. And I'm not saying this for the rest of your life, at least till you're conceiving, right? Till you want to have a healthy baby, till that phase of time, please avoid. And of course, smoking and drinking is an absolute no. It doesn't matter. And if you're trying to start in next, say, 3 to 4 months, then you need to give up prior of time. Not the months that you're trying, but prior to that, to completely stop drinking and smoking. And the same goes for the husband as well. A lot of times,
Thank you for coming up
yeah,
with that.
yeah, so it's not just the wife. Husbands have to lose weight as well, because uh, it really matters on their end as well. Their weight matters, their sperm quality matters, their sleep quality matters, right? So yeah, both of you should be stress-free, sleeping well, eating well. And if you're really trying to have a baby in a healthy environment without any kind of medical invasion, please try to take your time. A normal woman takes anywhere between 4 to 5 cycles to get pregnant. Any woman with a regular period. For a woman with PCOS, it takes anywhere between 8 to 9 cycles. And it's not because you have PCOS, it's because of the ovulation and the way your body is structured, right? So that's the way. So yeah, people try to conceive in a month and they go to fertility doctors. Please don't do that. You don't need to do that. Give your body time. And yeah, I hope I answered in the most easiest way. But yeah.
Thank you. Actually, Roshni, yes, totally I agree with you because with the kind of lifestyle we had started leading, uh, lifestyle change is a very important factor, and people who start thinking about a family,
Mhm.
at least get your preconception checkup done so that you know what lifestyle changes you want to do. If you have PCOS, accordingly. If you don't have, accordingly. If you have thyroid, accordingly.
Mhm.
If you have gut issues, accordingly. So it's very important to make that nutritional change in your life so that you can prepare yourself for a healthy conception,
Yeah.
right? So I want to understand one thing, okay, since you mentioned people with PCOD and PCOS conceive. Okay, this myth is broken, right? It's not a myth. It's a myth basically. So,
Mhm.
right, if you conceive with PCOD and PCOS, are there
Mhm.
any hormonal or any other implications during your pregnancy? And if yes, what are the other meal plan changes that one can make so
Mhm.
that the pregnancy is a healthier one and you don't develop symptoms like gestational diabetes,
Mhm.
hypertension, hypothyroidism, which has become like very, very common. Like earlier,
Yeah,
I think it was, oh my God, now it's like, okay, it's okay. Like, we're
it's normal
normalizing it,
for a
and
lot of
it's not. We should not normalize this,
yes,
right?
agree.
So, yeah.
So, first of all, if you're trying to get pregnant, try to reverse your PCOS completely and then try to get pregnant, right? So that means your body weight is in the right levels, your hormonal levels are completely right, specifically your thyroid, and also your insulin resistance is not there. So these three things are very important. If you are, I mean, if it's all a check, then the possibility of you having any kind of pregnancy complications is almost zero. All right, when you're pregnant and you could be someone who doesn't have, I mean, you might have hypothyroidism, which on its own makes it super hard to get pregnant because of ovulation issues and all of that. But when you do get pregnant and you are a little, please do not gain excessive weight.
Okay.
I mean, this is the amount of grams that you can gain in this period of time, right? So, one second, I think I lost you.
I had lost you in between, but I think now it's fine.
Now it's fine, right? You can hear
Yeah.
me clear, right? Yeah. So, like I was saying, every scan that you get done, please go and ask your doctor what food can I eat. Each doctor, I mean, most of the doctors that I have seen with my sisters, they are very very sensible. They say, try this exercise. Do not stop walking. A lot of doctors say, just stop walking. Be so fragile that if you walk a little, you have a miscarriage. Do not believe in that. Each doctor will have their own history, so go to a doctor. Pick your doctor really well. I think that is the reason why complications also go less. If you pick your doctor who is understanding of your situation and tries to prevent you from having any complication, that's the best thing. Do not gain excessive weight. Do not believe in eating ghee and a lot of Indian pregnancy things, because sometimes that would be detrimental for your pregnancy. And most important of all, take it slow. If you are pregnant and you're super stressed, then it's just not okay for the baby. A baby grows happy when it's in a happy environment, right? So yeah, please don't gain weight excessively during pregnancy. That's the one thing that I've always tell people.
You know, um, I'd read somewhere, and I think sometimes it happens. You read something and it stays with you.
Mm-hmm.
So that this article I was reading, and it said that if you're going to do a run, right, and if you're warmed up, it's
Mm-hmm.
more easy for your body to pick it up and stay
Yeah.
active. So
Yes.
if you're active, your
Mm-hmm.
body will have that energy to
Mm-hmm.
sustain the pregnancy and to have a normal delivery. But if you're sleeping and one day somebody tells you, start running 1,000 kilometers, you can't do that. You have
Exactly.
to warm up yourself, right?
Yeah.
So same goes for pregnancy when you say, walking and, people have questions. Can I sit down on the floor? Yes, you can. But it has
Actually,
to
there,
be
in Muslims, there's a tradition to read Ramaz, right? They read it 5 times a day. A friend of mine is pregnant and she does it. She kneels down and gets up. And trust me, that's the best thing. And in many, I mean, most religions, it's not that. In Muslims, it is. And it is such a good practice because in my family, we're Hindu, and my mom would never let anyone be like, oh, don't touch someone's leg, don't bend down to pick something up, don't squat. But the minute you hit 8th month, you're done with your 8th month, and 9th month starts, everyone asks you to start jumping and squatting.
yeah,
How is your body going to be
yeah,
okay with that,
exactly.
right? So it has to be a but most important of all, I'm very happy with the generation we're in. There are a lot of pregnancy educational sessions and classes that I've seen online now for both the parents to acknowledge and say, this is normal, which isn't shape of the baby, size of the baby, and all of that. So it's really nice to see that as well.
Yeah. So this generation wants to be informed. They want to
uh,
prepare, for everything. So I think it's a good one because now they are, trying to educate themselves so that, they know what is right and what is wrong for them. And obviously that is why we're having these sessions for everybody, right?
yeah.
Now we've spoken so much about nutrition and everything, right?
Mhm.
People, I think after COVID, maybe uh, people have, started being really, really responsible about their fitness.
Yeah.
Not weight loss exactly. Yeah. Initially it was only weight loss, but now people want, there's a new term, being fit, right?
Mhm.
So there I come in asking you the question for PCOD also. Um, like, they say that, being active, being fit, or picking up any activity which, interests you, be it gymming or running or marathon or swimming or yoga or Zumba or dancing, it really makes a difference in balancing the hormonal levels or helping reverse the PCOD and PCOS symptoms. Um, what do you have a take on that?
I feel people have started saying being normal, being moving is called being fit. I feel it's very wrong when people say, I want to be fit, so I'm going to start picking up activity. But that's the way of life, right? You're meant to move, you're meant to move around, you're meant to sweat, you're meant to stretch every single day. But with the way, with the way the world has evolved, it's made us just sit in one place. Like, instance, even now we're just sitting and talking, right?
Yes.
And that's just going to be an hour of just talking. But probably 10 years ago, people would be walking around, moving more often, playing more sports. So I feel moving is very important, whether you have PCOS or not. Honestly, if you don't have PCOS and you're not moving, that in itself will cause other issues as well. So just move. And a lot of people just struggle to walk 100 minutes a day. And that shocks me sometimes. When I say, you know what, just walk 10,000 steps, they're like, that's 100 minutes of walking. But how many minutes are you awake in a day? Right? If you can't keep 100 minutes aside, and there are a lot of people who say, I have a very busy schedule, I'm a mom, this, but then if you have to make time, unless you don't make time, how would you see change in you, right? So yes, any form of activity is fine, any form of movement is fine. It could be yoga, swimming, badminton, walking, stretching, anything, honestly, as long as you're moving and preferably sweating a bit, it's good. And I would suggest that 100%.
So I have one more question. Like, if during pregnancy, right, a lot of people want to pick up new form of exercises. Like
Mm-hmm.
now, prenatal yoga and antenatal yoga have become so famous that
Mm-hmm.
people have started attending class, and before pregnancy they have never done all these. They didn't move,
Mm-hmm.
right? But now once
Mm-hmm.
they're pregnant, they suddenly realize that they need to change, right?
Yeah.
So what effect it has on the mother and on the baby's health, or it does not, what is the level of exercises somebody should do and should not do?
Uh, One thing is, if you are someone who hasn't worked out prior to pregnancy, do not risk in new form of exercise. I have seen a lot of cases where the woman, has miscarriages in 3 4 months because a it will be a completely new kind of sport or activity, which is very alien to the body, and then that just affects the hormones and leads to a miscarriage. If you are planning to conceive, then start working out at least 8 to 1 year ahead of time. And you're like, no, Roshni, but I'm starting to work out now. What exercise to do during pregnancy? Walk twice a day, at least say 3 kilometers each time. So walk 5 to 6 kilometers a day, because walking, on the other hand, it's something that you've been you doing all along, right? And also the right guidance. There are certified people to help you during pregnancy. They do cost a bit more, but only and only they are equipped with knowledge that can help you keep you safe and your baby safe, right? If you go somewhere, go join a group class just because it's just cheap and it's affordable, please don't. If you feel like there's any time during your life where you can spend on yourself, it could be when you're growing your own baby. So invest in the right instructor. And I don't prefer strength training to new moms or pregnant women who have not done this prior. At least a year and a half of proper weightlifting is only when I would suggest them to do it later.
Thank you
Yeah.
so much, Roshni, for answering that. And we couldn't agree more for certified experts to be your
Yeah.
consultant. Because obviously, First Parents does that, right? We
Yeah.
provide certified consultations and a workshop through pregnancy for other aspects and every aspect of pregnancy and postpartum. Okay, my last question with you, Roshni. Gut health, okay, that has become the another sensation these days, right? All the people on Instagram, influencers, nutritionists, or people who are little out there are talking about gut flora, right?
Mm-hmm.
Suddenly, it's always been there, but now people have started talking about it more and more, and both of us know, right?
Yeah.
Gut issue is one of the reasons that you don't conceive, and
Yeah.
it goes under the section of unexplained infertility. Everything is
Yes,
normal, the
absolutely.
reports are normal, you're doing absolutely fine, you are ovulating on time, periods are normal, but I'm not conceiving, or somebody's not conceiving. Why? Gut
Mm-hmm.
health, right? And that is something people live with, and it goes undiagnosed all your
Yeah.
life because you think that's a normal way of living, right?
Mm-hmm.
uh,
Mm-hmm.
what are the some I have two questions under this, right?
Mm-hmm.
What are the some symptoms that people should look out for, because most of the people don't know they're living with it. And if they come to know that these I have a gut issue, or I have a gut inflammation, or a gut disease, or a Crohn's, or a
Mm-hmm.
colitis, or any kind of illness, what are the changes they can do in their lifestyle so that they can bring that to par, or try to reverse that, or bring it under certain levels. So
Mm-hmm.
yeah, that.
Okay. So couple of things that will indicate that you have really bad gut would be your bowel movement. You can't poop every morning. You're struggling to poop. So that's number one. Second thing is you have unhealthy skin. That could be your skin is dull, you have acne, you have dark circles, something of that sort. Anything that is visually seen on your face could be gut health issues. Number three, worst stage of gut health is when it leads to hair fall as well. Hair fall is something that I've seen is directly linked to your gut health. So that's something that I've seen very common. And as soon as gut gets better, your hair starts to grow, and then it's more nourished, right? So if your gut health is not okay, your nutrition isn't getting absorbed, and hence everything that your body needs a nutrient for are dying, right? So that's the third thing. Fourth would be you're not able to process food, right? You're not able to digest the food. You have burping, you have gas, you have this constant pain in your belly. And sometimes when people have gut issues, they can't touch their stomach hard. If you've seen when you have loose motions, or you have constipation, if you touch your stomach, it hurts, right? It's almost like a wound inside, right? So if someone has really bad stage of gut health, if you can touch your stomach, press it without pain, that means your gut is fine. This is, and if you can feel a little uneasiness, then it means something is wrong with your gut. So these are very common things that people can identify with gut health. The only thing that I can tell, like a list of things that good food is to, if you have very bad gut health, avoid processed food. There are people who move from India to say Canada and US, and how, not just Canada and US, anywhere other than India, right? The food is super processed. The way things are grown is super processed, and their gut is gone. then they start losing weight. Gaining weight and losing hair, right? So processed food, a big no. Most important of all, if your gut health is really bad, try to avoid alcohol for a time being, for some time, because that really affects negatively on your gut health. Eating good vegetables every day, eating as much raw vegetable that will feed your microbiome, that is very good. Cooked vegetable to give you the nutrient that you need. And yeah, any fermented food. South Indians are lucky to have idli, dosa, appam. So have that. If you love kimchi, if you love making kimchi, have that. Sauerkraut, curd. Curd is probably the most easiest way to have a good gut. So having curd every day if you're dairy tolerant. So yeah, these are the basic things that you can do. And over a period of I think 3 to 4 months, you will see a huge change in the way your gut reacts. And gut takes quite some time. It's not a period of like a short period. Specifically, one negative thing that affects gut is antibiotics, medicines. So when you are taking high dosage of antibiotics, which I'm sure a lot of us are right now because it's the flu season, gut goes for a toss. And that's when you have to rebuild your gut. So you need to be very gentle with your stomach, eat very, very less spicy, not bland, but little less masala food, have curd and things like that to rebuild your gut and of course get back to normal.
Okay, thank you so much for answering all the questions, Roshni, and turning the session into a very informative one on PCOD and PCOS. Because, as I think, this topic is something, how much ever we talk, it's not enough.
Absolutely.
But today, I think we've learned a lot about, how to manage and balance a well-balanced diet for everybody, tailored exercise routines, which you've told us about, and how to have proper nutrition-packed food to manage our PCOS and PCOD journey, right? Not only because anybody wants to start a family, but it starts very early on as puberty and till menopause, I think, right? Because that is also another issue. I think I want to take it up another day because
Absolutely.
moms and all.
There's a lot to talk about menopause and premenopause. That's a lot. Yeah.
So for all the users, I think we've empowered you with a lot of information and valuable knowledge to navigate this journey of yours. Please be aware, be informed, and start your reversal process way ahead of time. It will help you stay healthy and fit. Thank you. Thank you,
Thanks a
Roshni.
lot. Thanks a lot. Have a lovely day, everyone. Bye bye.
Bye-bye.